You have one of those apps that supposedly will transcribe it?
I do.
Oh, even better. You can give that to me when I'm doing my minutes and maybe I'll actually get everybody's name right the first time.
Is a good effort at being polite sufficient?
Hi, Dr. Robinson.
Hello, how are you?
Thanks for joining us.
Oh, I'm delighted. Thanks for the invite. Sounds like a dog.
Hi, Tina.
Hi, Alan. Thanks for the invite.
Sure. It'd be good if we get to the county executive, it'll be great.
Well, these are certainly interesting times, aren't they?
They are interesting times.
Cliche.
Did you know that that is a Chinese curse? May you live in interesting
I
times.
did.
Well, let's wait just a few more minutes before we get started. Hi, Yudi.
Hi, Alan. Good evening, everyone.
Hello,
Me.
Hey,
Ellen, how come you have a picture of a school bus behind you?
It's because we're a civic association. That's my neighbor.
Got it.
Pedestrian safety. That's also the route of the Purple Line. That's Wayne Avenue and Dale Drive intersection.
Hmm.
It doesn't look like that since they cut down all the trees.
well, I started
How
my
do you
newsletter
feel
out
about
this year calling it the terrible, horrible, no good, very bad year. So
And Queen
Anybody
Elizabeth
who's
said that.
kids literature.
Queen Elizabeth said that when they had a fire in her palace.
Oh, yeah. Well, it works pretty well for a lot of circumstances.
Well, we've got a good crowd. Our featured speaker is not here.
Okay.
So why don't we get started? And why don't we start with introductions? That will take some time and some good people on here. I'll read people's names off of my screen. So if you just say your name and where you're from, if you belong to a civic association or any other thing you'd like to say, starting with Jerry Garson.
Hi, I'm Jerry Garson. I'm the treasurer of Montgomery County Civic Federation. And I'm also involved with Regency Estate Citizens Association.
Louis.
Hi, I'm Louis Willen from Cherrywood, and I'm also the utilities chairperson.
Mr. Ahmad.
Yes, I'm Dean Ahmed. I'm a former Montgomery Civic Federation president, and I'm a member of the East Bethesda Citizens Association.
Jackie. You're still muted, Jackie.
Sorry, I thought I posted it. I'm Jackie Bocco. I do the web page and the newsletter for both the Marc Elrich is joining us now. I do the newspaper and website for both the Civic Federation and my own civic association, Northwood Four Corners.
Ken.
Hi.
Karen Cordry, I'm recording secretary. This is my cat Angus, who will join us for a moment. Kensington Heights Civic Association, which we surround the Wheaton Plaza Mall.
Ken Bauer.
Yes, hi. Ken Bauer, West Montgomery County Citizens Association.
Pete Salinger.
Pete Salinger, Springfield Civic Association, which is in Bethesda.
Bailey Condrey.
I'm Bailey Condrey. I'm with the Parkwood Residents Association, and I'm a past president of the Civic Federation.
Kira.
Hi, I'm Kira Luders, and I'm the president of the Parkwood Residents Association.
David Miller.
David Miller. I'm past first VP of both GOKA and Norbeck Meadows Civic Association. At the moment, I'm taking some time off from active Civic Association work because of personal matters that need attention, but I will be more active soon.
Lucky you, David. Alan Myers.
Yeah, Alan Myers, president of Maplewood Citizens Association. A long time no see, Dean. Haven't seen you since our days in East Bethesda.
Tina Patterson.
Thanks for thanks for calling my name, Alan. I'm Tina Patterson. I don't belong to a civic association. I'm actually a member of the Montgomery County Planning Board. County Executive, it's good to see you.
Welcome. Jeff Griffith.
Hi, Jeff Griffith, Parkwood Residents Association.
Sandra Robinson.
Sandy Robinson. I am a member of Progressive Legacy and also the Democratic Club of Leisure World. Thank you.
Joe.
Hello, everyone. I'm Joe Weber. I am the student member on the board for Committee for Montgomery.
The other Joe, Joe Awkward.
Yes, hi, good evening, Alan team. Joe Awkward, Vice President with Maplewood Citizens Association.
Tony Hausner.
I'm with the Indian Springs Citizens Association.
Yudi Rodriguez.
Thank you for the invitation, Alan. I am part of the board of directors of Safe Silver Spring.
Matt.
Assuming that was me since nobody else answered. Matt Losak, Montgomery County Renters Alliance.
All right, I'm going with the people I see, but I see Francis. Are you on there?
Yes, my name is Francis Siegel. I'm just a member of the Northwood Four Corners Civic Association.
Okay, thank you very much. Paul, are you there?
Paul Jarasinski, president of the Cherrywood Homeowners Association.
Amy Henchy. You're muted, Amy.
Amy Henchy, I live in Northwood Side. I am not representing the Northwood Side Citizens Association. I believe Jean Kavanaugh has that privilege and honor, but I do appreciate the invitation, Ellen.
Joan?
My name is Joan Bierweiler. I'm a member of the Aspen Hill Advocates.
Hank? Hank, you're muted. We can't hear you. Now you're muted for sure. Hank, we'll come back to you. Peggy?
Peggy Dennis, past president, past newsletter editor, and currently serving as legislation chair. And boy, am I busy because there's a lot about to go on in Annapolis.
Okay, Stan Boyd. You're muted, Stan. You know, we got a button to push.
Now,
yes.
Am I on now?
Yes.
Okay. I'm Stan Boyd. I want to thank you, Alan, for inviting me. I'm with the Faith Alliance for Climate Solutions, and I live in Kent Mill, which is near Wheaton.
Yeah, we know Kent Mill. Robert Janku.
Robert Janku, I'm with the treasurer for North Potomac Citizens Association.
Thank you, Robert. Village manager.
I'm Andy Leon Harney. I'm the village manager of Section 3 of Chevy Chase.
Patricia Johnson. You're still muted, Patricia.
I'm on the executive board of the Citizens Coordinating Coalition for Friendship Heights, and I'm a member of the Kenwood Citizens Association.
Thank you. There are a lot more people on. I'll greet Jean and Dio and Barbara Hoover and Cynthia and Marilyn and Jerry Kickinson. And I don't know, we're up to 44 people, so that's good. So thank everybody for joining us. If you'd like, you could put your name and association in the chat. But let's get to our agenda and to our guest speaker this evening. My name is Alan Bowser. I'm the president of the Civic Association. And for Civic Association, the first thing we would like to do is approval of the agenda, which is on page 2 of the newsletter. Motion to approve the agenda.
So moved.
Second.
Second.
All those in favor say aye.
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 All right, the next thing is the approval of the minutes from the December 14th general meeting. It's on page 25 of the newsletter. Do I have a motion to approve the minutes of the general meeting?
So moved.
Second.
Second.
All those in favor say aye.
Aye.
Those opposed? Abstentions? Thank you. Jerry, the treasurer's report is next.
We operate on a fiscal year from July 1st to through next June 30th, but this is through January 11th. We've received revenues of $1,163 for memberships. If anyone would like to send their memberships, we'd appreciate it. And we've had expenses of $733, giving us a net income for the period of $430. And the only, we had gotten some additional membership dues in, and we paid for our post office box. If anyone has any questions, let me know. Thank you.
What's the balance?
What's the balance, Jerry?
Oh, $9,678.
Thank you very much. The next thing on our agenda is announcement. Anybody have a very brief announcement they'd like to make to the group? Okay.
Well, Alan, I have a quick announcement. Hi, this is Mary Lynn. Happy New Year, everybody. I am the vice president of the Rockville Mid-County Democratic Breakfast Club. Next Monday, January 18th at 7:30 in the morning, we are having Senator Chris Van Hollen as our speaker, and we would really love it if everybody could join. I'm going to put my email in the chat so that way people could contact me so I could send them the Zoom link.
Marilyn, will you put the information about that in the link too, so I can make sure I got it down right for the minutes? Thank you.
Okay, I will. Thanks.
Thank you, everybody. Just a note, please mute yourself if you're not talking, because I hear some squeaky noises. We're finished with announcements, but I'd like to read a statement from me. It's about Tommy Raskin, who tragically lost his life on New Year's Eve. Remembering the life of Thomas Raskin. I'd like to take a moment to remember and pay tribute to a remarkable young man, Thomas Raskin, whose life tragically ended on New Year's Eve. In any measure, Tommy Raskin had a life well lived, and we are all better for his many contributions that enriched our Montgomery County community. His parents and our friends, Jamie Raskin and Sarah Bloom Raskin, have warmly recalled Tommy's many gifts to his family, friends, and community. Always brilliant, compassionate, and full of energy, his life journey through Montgomery County Public Schools taught him the valuable lessons of the importance of curiosity, generosity, and public service. His memory should stand as a bright beacon calling others to do the most good and to be selfless in worldly affairs. We commend the numerous exemplary actions that Tommy took throughout his young life to lift others and improve the conditions of those he never met. His level of volunteer spirit and commitment to community engagement while suffering from a deadly disease embodied the spirit and dedication of those who serve the Montgomery County Civic Federation. His passing has left tears in our eyes and an emptiness in our hearts. We express our most sincere and deepest condolences and sympathies to his family and friends for this tragic loss, and we know that his memory will be a blessing. So I wanted to do that. So turning to this evening's program, we are so fortunate to have with us this evening our friend and the county executive of Montgomery County, Marc Elrich. I've asked him to just a tour of the horizon of what he's confronted over the course of his term, to mention something about the COVID-19 pandemic, which has affected all of us and everyone. And we'll have an opportunity to ask him questions for as long as he wants after he makes his introductory remarks. So without further ado, let me introduce our friend and our county executive, Marc. Thank you for coming, Marc.
Thank you. Always good to see everybody, and a lot of familiar faces on here over many years of civic work. So it's good to see that people are still active, engaged, and care that much about Montgomery County. So I'll talk a little bit about, sort of like the landscape of being county executive right now. I'll start by saying this is not a terrible lot of fun. If you remember, I got elected in like November of 2018, and I took office on December 4th, I think, and 2 days later, finance came in and said, oh, by the way, there's a $60 million shortfall in this year's budget, and you have to make $60 million in cuts. And that shortfall had been known about since September. And so instead of putting a savings plan in effect back in September, I had to figure out how to put a savings plan in effect, which we did in January. That was hard enough. And then 2 months later, when we were getting ready to present our budget to the council, a couple of weeks before that, the state came along and said revenues for the state are down, and Montgomery County is going to have, I think it was $40 million in less revenue. So there we were, taking a budget that we had pretty much put together, which was Ike's budget, because that's the budget that I walked in with that departments have been working on. And so we had to make another $40 million in cuts, which is not fun. You don't get to do much new stuff or any new stuff when you don't have money. A lot of that was due to the stupid property tax law that we had in place, which we no longer have in place. But that certainly contributed to the problems we had. I just say it was very challenging to work through that. But I had told people when I was running that there was no money, and I wasn't going to promise a whole lot of stuff. The only thing I said I was going to do, I said I was going to do childcare because that was a priority, and I was going to work on bus rapid transit because we have to figure out how we're going to get people moving in Montgomery County. So my staff went forward with planning bus rapid transit more, and we did additional work on early childhood education. We expanded those services in my first year, and the rest was a very, very conservative budget. So you go forward another year, and here we are doing a budget. There we were doing a budget again last year. Just as we deliver the budget, COVID breaks out. And so everything we knew about what we were going to do was going to change. Programs that we had planned on weren't going to happen. Revenues that we were going to count on, which would have been income taxes that we would have collected this year, did not materialize to the degree that we had hoped. And so once again, we were kind of faced with how do you pivot a budget on a dime, and how do you make the best out of a really bad situation? So for a lot of the things that I wanted to do, it's been really a struggle to do a lot of it because the resources just to kind of melted away over the last 2 years. And in my, I spent 12 years on the council, and it was probably, this is the hardest time I've seen the county really go through in a physical sense. We are obviously in the midst of this pandemic. I remember the heady days of May when we were contemplating reopening for the 4th of July, and how people thought that this thing would be pretty much done with by the end of May. June would be a bit of an uptick in the slow recovery. We had a financial assistance program for business that we gave out probably in 2 weeks or 3 weeks that covered the second half of March and April. And we thought, okay, well, it'll just be another month that won't be covered, but this will all be over with. Well, here we are 10 months later, 11 months later, and the pandemic's not over with, and we're still very much dealing with it. And it's just been a real tragedy. There's no other word for it. We have, we're north of 300 cases now. I think we're over 1,000 dead or close to it. It's been, in the late summer, we had gotten cases down to 4 or 5 per 100,000, which translates to 45 or 55 cases a day. And yesterday we were looking at 600 cases. We gotten test positivity down to between 2 and 3%. And we're up to 8.1 or 8.4, depending on the day. So things have not gotten better. It has not helped that the rest of the country did not go on a lockdown. Montgomery County is not an island, so people travel back and forth. I've insisted and supported my health officer in opening things more slowly than the rest of the state, because I was very much worried about the second coming of the pandemic and what would happen. And I knew it was going to happen. I knew I couldn't avoid it, but I wanted the virus to start from the lowest possible base when it started to come back again. And so we had probably the lowest possible base except for 0. And when it came back again, as bad as it is, most of the state's actually in a worse shape than we are. And we're the largest county in the state. So we have, erred on the side of protecting people. And I try to remind people that this has been, this is like the worst choice that you make in your life. It's like a Sophie's choice, in a sense, that I can protect people's health, and everything I do to protect people's health kills businesses. It's just flat out true. I have to cut down the contact between people. I have to keep people out of rooms for long periods of time. I have to do all those things that minimize the spread of the virus. So if I protect people, then it's really not good for business. If I protect business, it's not good for people. People gather more, they eat together, they socialize together, they infect each other more, and the virus grows, and then it runs out of control, like you see happening in California now. So it's not a fun choice. I don't enjoy either of any of the decisions I make. We've done some openings, but we always lag behind the state in the things we did. We never got out front of it. I've had support in the 8 big counties, primarily the 7 big Democratic counties, for a more cautious approach. So all of us have been more cautious, but some of those counties are what we call purple. And so you've got county executives who govern with the fear that they either immediately followed on a Republican county executive, and they know that there's a large Republican reservoir in the county that doesn't believe in coronavirus, doesn't believe in the safety precautions we're taking. And I feel lucky to be in a blue county where, even though I get some opposition, I've been able to do more because I know that most people here understand why we're doing what we're doing. And I feel real privileged to be able to govern in that environment, as hard as governing in that environment is. We have put, as county executives, pressure on the governor on testing. We pressured him on not opening so fast. Now we're in a struggle with the state over getting vaccines. And part of the problem is the state's struggling with the federal government. They do not get vaccines in the quantity they need. Trump is holding back half the vaccine supply. Now they said they're going to release it. The state was holding back its supply. The first week we got 100 doses of vaccine. The second week we got 8,500 doses. This week we got 6,700 doses. We're only in stage 1B of being able to vaccinate people. There's just a lot of people we have not been able to get to and aren't going to be able to get to for a while with vaccinations. And aside from us, the hospitals get direct supply from the state, and nursing homes were getting supply from CVS and I think Walgreens. And the state went along with the federal program. This was a federal program. There was an article in the Post this morning that talked about why West Virginia has been more successful. And West Virginia didn't follow the federal program. West Virginia got the doses out to all the small pharmacies in the state, and were able to get better coverage of the nursing homes and the centers that they needed to cover, better than the state's been able to do. I believe that the state is giving us the vaccine they have, since we find out on, like, the last 2 weeks, we found out on Saturday what we were going to get delivered to us on Tuesday or Wednesday. So we have a week to get rid of it. We have more than a week, but generally we want to get rid of it before the next next load of doses comes in, which we've been able to do so far. But the state doesn't know what they're getting until earlier that same week. And so none of us were able to plan more than a week in advance. So if you go on our website and you look at our COVID metrics and you see all the stages, and the first thing you're going to say is there's no dates here. When am I going to get to 1C? When are you going to get to 2A? When are you going to get to 2B? I can't honestly tell you because I don't know how many doses I'm going to have next week. And when we get to the point, hopefully with Biden loosening up restrictions on federal virus, somebody will give us a plan. They'll tell us how many doses are coming to the state. The state will tell us how many doses we're going to get and when we're going to get them. And then we'll be able to manage this plan better. But right now we have a program in place and we've got the ability to put them out. We're just not getting enough vaccine compared to what our ability is to put it out there. It's unfortunate, but I guess it all starts, as we know, with the federal government, which has utterly failed everything during this pandemic. And then it comes home to roost with us at the end of the day. We've done a lot of financial assistance in the pandemic. We've put out, we had emergency assistance relief payments that were over $20 million. We put out renters relief. We've had multiple business relief programs, and we have restaurant relief and another tranche of it coming out now with more money coming from the state. And today the governor announced there's going to be more money coming from the governor. So we're optimistic that there'll be more business support coming forward. We've got a reopen Montgomery grant. We've been able to help tourism and anchor institutions. We were able to get financial assistance for primary care physicians and dental practices. We have a public health emergency grant for businesses and micro enterprise stabilization funds. We've given money to child care providers twice for operating and then for reopening. We've got an arts and humanities fund. We're giving out food assistance. We've probably given out millions of packages of food. It is amazing, and they're just wonderful partnerships that we've developed. So we've done all that, and it's just really trying. We don't have enough money to make businesses whole. I wrote a letter to the governor back in March telling him he really needed to think beyond COVID and think about economic recovery. One of the real problems we face is that there are landlords who cannot evict people right now, but will be able to evict people at some point when the emergency ends. And if you're an individual and you're behind 3, 4, 5, 6, 7, 8, 9, 10 months in rent, and we're not able to give that much rent support out, you stand the chances of getting evicted when this crisis is over. And there are lots of businesses out there that haven't been able to pay rent because they've been closed or operating on limited staff and limited sales. And unless we get money from the federal government or the state to support up their back payments of rent, when this is over with, many of them are going to be presented with bills they're not going to be able to pay and may well lose their businesses. So this is, even as we have the vaccine on the horizon in the light of hope, it's really a disaster for people. And it's going to continue to be that way for a while. And hopefully Biden will be able to get a real relief program through. He'll get relief for governments like ours, which have had to spend a lot of our own money beyond the CARES Act money to keep providing services to people. And we'll hope that they're able to provide additional rental support for people. But it's been a long, hard slog. That's the only way to put it. Every day it's sort of like, you're banging your head against the same wall, trying to figure out what are you going to do. And mostly what you try to do is keep the situation from getting worse and minimize the damage and hope that the cavalry, pretty much in the form of a vaccine, actually arrives. I'm pretty optimistic about the vaccine. I saw today that Pfizer and Moderna are going to ramp up their production of the vaccine. Why this wasn't done and paid for before is beyond me. There are at least 2 more vaccine candidates, one from Novavax, which is in Montgomery County, that will likely be coming to market in the next month or 2. And having another large supplier or 2 large suppliers of vaccine will shorten these timelines. but we're not going to get to shorten the timelines until we actually have more vaccine on hand. So we're waiting like everybody else is waiting. We're talking to our congressional delegation. I joined the call with Tom Hooker and Peter Franchot and a bunch of county people from around the state yesterday, calling on the governor to release more money. So today he put up $1 billion, not quite where we wanted them to go, but at least it's a step in the right direction. So that's COVID. And fortunately, there's more to life in COVID. I told my staff when this started that they had to keep focused on all the problems that were in front of us before COVID hit. Because when COVID goes away, every problem we ever dealt with is still going to be staring at us. None of our problems, none of the things I was interested in trying to deal with went away because of COVID. And some things were made worse, some things were postponed, and some things just, we're not going to get to for a long time because there's a lot of needs that have pushed themselves to the front. But I'll talk about some of the things I think we learned from this. Most services in the county people had always gotten by accessing Hungerford Drive, Picard Drive, basically coming to Rockville. And back in the summer, we made a decision to push some of our support out into the communities, to use community groups to support our testing platforms in the Hispanic and African American communities. And in doing that, that blossomed into food support, and it's blossomed into social service support. And so we've realized we could actually put more people out in the field and still get the work done. And the thing is, it really makes it easier for people in the communities in Montgomery County, particularly people who rely on buses, to be able to go to a local service center and have some of their needs addressed. So one of the things that will survive the pandemic is we will continue to have hubs out in the county, and the hubs may be point of service or places to come in and be able to telecommunicate with folks in Rockville without having to actually go to Rockville. Another good thing about the pandemic, in a bad way or a good way, when I came in, I wanted to do more teleworking. Montgomery County had the best unused teleworking policy in the country. It was really good policy, and we made it impossible for people to use it. So we had 2 rounds of teleworking. We told our managers to give us a list of who could telework, and they did, and there was not enough people on the list. And we said, get serious, we really mean this. We're not going to shut the government down, and we need everybody working at home who we can get working at home. And we wound up approaching 70% of the workforce that could telework. And we were able to do that. And it has lessons for us going forward. We are likely to continue a very high ratio of teleworking. What we've learned from our employees is they like teleworking, but they like human contact. And so we're probably going to come up with hybrid schedules where people split their time between the home and between the office. You might do 2 days, 1 week at home and 3 in the office, and next week do 3 at home and 2 in the office. That should lead us to needing to release less space. And so we'll be able to get out of some of the space we're leasing, which would be a good thing. It actually is a boost to morale for employees, and it's been really valuable in learning how you manage employees remotely. We used to say that, when you're in an office, the way you manage somebody or the way you evaluate somebody is that you sit in the chair for 8 hours. And your day's done. You sat for 8 hours, you've done your work. With teleworking, you had to come up with metrics. Departments had to say what their expectations for work that's being done. And the thing is, if somebody gets the work done, they get it done in 7 hours and 15 minutes instead of 8 hours, do I really care? If someone's motivated to work harder and faster because they get a benefit from doing that, that's fine with me. And we've discovered that employees who have that liberty actually feel a little bit better about their work. So we're trying to take what we've learned on the employee side and what we've learned on management and what we've learned about the need for a combination of being in the office and also the ability to stay home that'll likely stick with the county as we go forward through this. So those are important things. The health initiatives are really important because beyond the hub, the health initiatives were really an effort to deal with the underlying racist legacy that Montgomery County has, just like every place else in America. And so we look at the death toll and the case rates in the minority community, particularly the death toll in the African American community. It is really clear that this is being driven largely by underlying conditions, pre-existing conditions, lack of access to medical care, and lack of trust in the medical care system. And I am always amazed when you hear, Black people talking about the history of medicine and Black people and how I wouldn't take a vaccine. I don't trust them. And that's kind of developed over years of abuse of the system by the people who were supposed to be the doctors taking care of Black folks. So we've learned that there's a value in being deeper in the community and having people who the community authentically trusts. And that's true for all the minority communities. There is something about the authenticity and seeing people who look like you and who share common aspects of culture with you to be the same people who are working with you. So I think you're going to see more of that as we kind of push through this and get out on the other side. We are still not sure what we're going to open this year. I mean, I don't see at the rate we're getting vaccines right now. For example, if I was given 16,000 vaccines a week, which is twice what I had this week, and I had to revaccinate 8,000 people, and once you start doing it every week, that means every 4 weeks, every week essentially, somebody who got vaccinated 4 weeks ago needs to get vaccinated again. So we could use, if we had 16,000 doses, we'd use 8,000 for revaccinating and 8,000 for initial doses. And just the senior component, which is somewhere between 75 and 90,000 people, I forget the exact number. At 8,000 doses a week, you're looking at 11 to 12 weeks just to get to the seniors. After the seniors are the frontline workers. Think about all the grocery stores, all the employees of Lowe's and Home Depot and all the other big boxes, all the front-facing workers who aren't healthcare workers. Those are all people who get vaccinated next. So unless we wind up with a substantial increase in vaccines, it's going to be a very long time before we get around to the general population. So we're all concerned about that. We're all hoping for the vaccine companies, but we're also recognizing that there's a lot of stuff that won't reopen in Montgomery County, possibly for the beginning of the budget. It's hard to imagine, for example, recreation programs in the early summer. It's hard to imagine things will be different enough that we'll be able to say yes to that, particularly to say yes to indoor activities. I don't know how much you all follow the details of the virus, but one of the disturbing things was the realization that the virus lingers in the air longer than people think. And so it's not just wearing a mask, but if you're in a room for a prolonged period of time, the effect of the mask diminishes. Our masks, unless you have an N95, are imperfect as they are. There's leakage around the sides. You know it when you're wearing it, you can feel it. And so if you've got leakage around the sides, you're potentially getting small doses of vaccine. But if you stay in a room for 2 to 3 hours, small doses become bigger doses and put you at greater risk. So those kind of things we're going to have to deal with for a while. They don't know now. They don't know yet whether you can be vaccinated and still get the virus. Only you get a mild case. You may not even know you have a case, but you could still be spreading it to people who haven't been vaccinated. So these are all the fun things you have to think about that just make this much more complicated than we'd like it to be. We're doing some other things that I think are also interesting. We opened the flash line on Route 29. I told them they couldn't call it bus rapid transit until they fixed the lower part between New Hampshire Avenue and Silver Spring, where it all runs in mixed traffic right now. So they're looking at a model where it won't run in mixed traffic. It'll be peak direction southbound in the morning and peak direction northbound in the evening. We are in the redesign of 355 from Bethesda to Clarksburg. And the state is actually joining us to work on that project, as well as the one road addition I'm looking at is a place in Clarksburg where 355 narrows to 2 lanes and causes an ungodly bottleneck in the morning and the evening. And we're looking at taking that 1 mile section of road and widening it to 2 lanes. And we're redoing the CCT, the Quarter Cities Transit Way, which the state killed because the route we picked was really not a rapid transit route. So we've redesigned it closer to what the original alignment was. And we think we'll be able to get support and be able to move that project forward too. These are important things, along with the connection between Wheaton and Rockville along Revere Mill Road. So those projects are in design. We're looking at financing. I am pushing very hard, and this is where, folks in the Civic get to be really important. We need to replace the impact tax system because it doesn't work. The money, you can't bond against impact taxes because you have no idea when you're going to get the money. And because it comes in lumpy, what the county has done for decades is it waits until there's enough money in the impact tax fund, and then it does a project somewhere, anywhere in the county. So money that came out of, say, Bethesda for infrastructure in Bethesda could wind up being spent in Clarksburg. And there's no rules about where it's spent, and there's no way to bond against it because it comes in these lumpy pieces. By lumpy, I mean you only pay it when you go to put a project forward. So if you were in Bethesda and one project comes in the first year, maybe 2 years, 2 projects come in the next year, and maybe another project in the third year, and maybe 3 projects come in the fourth year, you have no money from any of those projects until they come in. And you don't know what's really going to come in the second, third, and fourth year until somebody files for a building permit. So you can't float a bond against revenues you don't know you're going to have. I want to do what Virginia does. They have development districts. Development districts tax commercial property, and commercial property, the taxes on commercial property pay for the bonds that lets Virginia build the infrastructure, which allows them to eat our lunch. And which is what is happening here. We can't build anything in Montgomery County. If I had to rely on the current financing system and the current capital budget, I could not build an interchange, let alone a major project. So we need a source of funding that we can borrow against. Montgomery County taxes are a little under $1. We're not planning a tax raise at this point. Fairfax County baseline taxes are $1.15. If you're commercial property in Fairfax County, you pay 12.5 cents more. And if you're in Tyson's Corner, you pay 40 more cents or 42 cents on top of that. All commercial property. That is how they fund their transportation infrastructure. Northern Virginia counties have a 12.5 cent tax that's on every commercial property that pays for transportation projects in those counties. We don't have anything like that here. So they're able to get the business community to contribute a lot more toward infrastructure. Our planning board is going in the exact backward direction. They're reducing the impact taxes and have no substitute taxes in play. So they've cut our revenues. We are having to reduce capital spending in this budget because the council has cut our revenues by the massive giveaway to the development on the metro, followed by the cut in the impact taxes that were in the subdivision staging policy. And all that money is infrastructure we're not going to be able to build. So unless the council comes back with another tax, we're going to have even a harder time funding what we were funding last year. That's why we're looking at the development districts. The irony is the developers would prefer to go to a development district system. And it's actually easy to understand why. When when you build a project in Montgomery County and you pay an impact tax, you have to borrow that money. It's literally can be tens of millions of dollars. You have to borrow that money at the beginning of your project. You have to finance it and carry it through your entire project. When you do the development district taxes like they do in Virginia, you're taxed on a 20 or 30-year bond. And the secret, which isn't so secret, is the property tax isn't paid by the developer once the development is complete and occupied. It's paid by the tenants. So it's the commercial tenants, office or retail or service, that pay the development district tax. But in exchange, they got all this infrastructure. They got a silver line. Every county in Northern Virginia is building bus rapid transit. So they're able to fund these projects over the long term by this mechanism that pays for bonds. And because they pay it over 30 years, the hit on anybody in any 1 year is less. And the more property that gets built, the lower the tax rate gets, because you're only trying to raise enough money to make the bond payments. So as developers build more development, the amount of square footage increases, and so the tax per square foot gets to go down. So I'm working oddly with the development community to bring forward a proposal that will replace the impact taxes with a system that lets us do long-term funding of infrastructure in the county. So that's, to me, that's a big deal. We're doing some other internal work. When I got elected, the unions had agreed to work with me on shrinking the workforce. We're doing this now. We have a team of union members and a consultant and managers, and we're looking at jobs and we're trying to figure out what are the jobs that we can replace. And what I'm trying to institute is a culture of, I don't care how you did it yesterday, it probably doesn't make sense anymore. If you think about the county or any institutions that have pretty long life, you know, many of the job descriptions and positions and structures were put in place before there were computers. So we don't reflect the best of technology and the best practices in the county. And so what I've asked everybody to do is to imagine, if you will, that you've arrived on your job and it's your first day and you know what the mission of the company is, but you don't know what your job's going to be. And to start thinking like a team and reimagine, how would you do this job today if you were designing the workplace now? Not how would you do it if you're walking into a job that already exists, but how would you do it if you had the opportunity to design it again? And I compare it to an assembly line, because what I've already discovered is because of the way we do things, the managers and the workers, they immediately say, well, my job is essential. And they're right. It's like if you're in a factory and you got an assembly line, pieces go down the assembly line. They stop at every station on the assembly line. Somebody puts on the front end assembly, somebody puts on the wheel disc, somebody puts on the brake system, and it moves down the line. Well, everybody's job is essential if everybody's job is defined as putting on that one widget and then passing it to the next person. But that's not the only way to design an assembly line and not the only way to design a workstation. And so, of course, you know, production has been vastly changed by combinations of technology and changes in work roles. And so what we're telling our people is, let's think about what we can do to do things differently here. And let's see what we can do. Imagine if you have 2 vacancies in your department and we weren't going to fill them, short of telling you you have to do a lot more work. How could you organize the department so that people would not be overworked, but you'd be able to do this work more efficiently? We've got some pretty amazing people in the county. The woman who's come in our IT department, Gail Roper, is a real gem. She renegotiated all our very bad Microsoft contracts. She has been doing innovative things. You're going to see chatbots on county websites. So we will fortunately not be last in the nation to discover this innovation. So she's moving forward with that. And we have this guy named Michael Baskin, who's sort of like the innovation officer. And he does these classes. He takes groups of employees, 30 at a time, I think. And then over a period of about 3 months, they do a quick class And then every employee picks something in their department they don't think works right, and they design a solution for it. And then they do this reveal at the end where everybody reveals their solutions to the whole team. It is amazing to see what happens when people's minds are liberated and they're told you can solve a problem. You don't have to do it this way. And so we're getting great ideas from people. We're going to be implementing those ideas. We have a waiting list of employees to sign up for these classes. They're very popular. We've even had people from other counties ask if they could come in and sit on these classes. So we've let them do that too. So I'm very excited about Michael and his work. We're also, for the first time into racial equity work now. The office is a tad understaffed. Tiffany finally got her first 2 staff members. They're charged with looking at everything the county does and evaluating it through a racial equity lens. Good luck doing that with 3 people. We're going to need more resources than that. But people are actually doing this now. And I'm sitting in meetings where they're having discussions about the budget, and they're talking about looking at it through a racial equity lens we found. And it's like, it's beginning to take root, which is what we wanted. Our goal is to train the managers, train the staff, train people on the staff, to train more people on the staff, basically train the trainers. And so I'm beginning to see this happening, and I'm really, really excited about it. Another thing that is exciting is the climate action plan. We took the first probably 9 months and we went out and had these committees. Some of you I know served on these committees. They came back with steps that we could take toward addressing climate change. I think it was hundreds of steps. And we brought in a consulting company to break those steps down, figure out, what is this going to cost? What are the right metrics? How do you develop metrics? How do you put those metrics in place? And how do you prioritize? How do you get the most bang for the buck and get that early in the process? And so this is all coming to fruition now. So we're now circulating the plan. We circulated with the committee. We're circulating it now with council members. It's going out to the public for comment, and we're really looking forward to that. But we didn't wait for this to happen. So projects we're doing right now is I introduced the school system to a company that has proposed switching over the school buses from diesel to electric over a 10-year period, and they would do it for no more than the school system would have spent on replacing the buses. It's a lease system, and it's really, if you're into a capitalist financing at its best, the county can't use tax breaks. So depreciation credits, tax credits for batteries, tax credits for electric vehicles, the county can't use those credits, and the county can't sell the credits. What the county can do is make a deal with somebody to buy things for us, lease them to it, but we build the tax credits and the depreciation into the price, into our payments, as part of what the person's getting paid, because they're not really obviously paying everything. They're getting all these credits that wipe out or bring down the cost of what they're leasing to us. So no point in us leasing at list price. We should be leasing at a discount. And so the school system put out an RFP for the school buses. We're looking to do something similar with 1,000 police cars and putting that out to an RFP. And probably at this moment, we'd be buying Ford Mustang Mach-E's, which are, these, what do you call them? Mini SUVs, whatever the cute word is for that. And they're no more expensive than the big heavy police cars we use today. So we think we're going to be able to come up with a similar deal for that. We've got the Holiday Park Senior Center is getting solar panels on the parking lot. They're supposed to be taking the windows and turning the windows into solar collectors using solar glass, which is basically transparent glass that has a treatment that lets you get solar energy from it. And then the parts of the building that outside of that, we're going to build another wall of solar glass to insulate the whole building. So It'll generate electricity and provide insulation. And we're thinking about wrapping the county executive building in a solar glass external wall to just see how much electricity we can generate. Because the only way I'll ever convince the business community or be able to tell the business community that you're going to have to do this to your buildings, I have to demonstrate that you can do it. It's feasible to do, and that it generates electricity enough to offset some or all of your electric bill, and it actually lowers your energy usage by providing this layer of insulation. So before I tell other people the things they have to do, we're going to start modeling them on a couple of our own buildings so we can see the feasibility of this. So those are things I'm really excited about. The last thing I'll talk about is I had an economic recovery group that I put together. I put 2 recovery groups together this summer. One was for the short term, like how do we deal with this mess and go beyond it? And the other was, how does this county get out of the mess it's in? Everybody knows that, we're kind of stalled for jobs. In October and November, there was a report done for the Economic Development Corporation by a group called Reach. And what Reach found is Montgomery County's economy stalled 10 years ago, has been flatlining ever since. And there are a number of reasons for that. One is a major disinvestment in federal spending at NIH, which drove down spending and related businesses and things inside the county. And the other is the county, its businesses had always pivoted to the federal government. And when the federal government started, shrinking and doing less business, these folks didn't pivot. And pivoting is, people use it like, of course you pivot, like as if you're in a basketball game. The fact is, you can say you can pivot, but turning a business around to another direction with a different product to a different customer is not as easy as it sounds. And if it sounds easy, then you've never been in the business. So the county really stalled, and they identified 2 things, and I'm going to tell you what they were. And they should sound familiar because I've been talking about this for almost 2 years now. I've said that the county's strengths are 2. One is life sciences, the other is the IT, and what we could do with artificial intelligence and machine learning and things of that nature. So the Reach report comes back and says Montgomery County has 3 strengths. One is IT, the second is life sciences, and the third is the hospitality industry. But the hospitality recommendations are in a different place, because if Marriott or Choice, if they grow, they don't really grow in Montgomery County. They're not going to build more and more hotels here. They grow internationally, and they may add staff back in the home office. So the big corporations worth a fortune, nice taxes on property, nice taxes for the state on income. We don't get that here, corporate income. But they do occupy a lot of space, and they do pay decent property taxes. But the other 2 are industries that we can grow in and we can dominate. We are number 3 or 4 in life sciences. We're number 1 in vaccines. So a year ago, I suggested that we try to acquire a joint development agreement with WMATA on the White Flint Metro. And we have signed the joint development agreement with WMATA on the White Flint Metro, 15 acres, the focus of which is going to be life sciences and computing. So that's number 1, 15 acres. And we're focused on jobs because, as other people have pointed out, and no offense to the planning board, but the planning board got this completely wrong. If you don't have jobs, you don't get housing. Without new jobs and growth in jobs, nobody's going to move to Montgomery County. You're not going to move to White Flint so you can hop on a bus, a train, or a car and drive to DC or Virginia or someplace else in Montgomery County. That's not the way it works. If you bring jobs to White Flint, all of that property that's zoned for housing will start filling up. People will build projects because folks will want to be close to where they work. So we're going to do something Montgomery County has not done, and that's have a jobs plan. And we're going to focus the jobs in these major industries. We're going to focus immediately on bringing them to White Flint. I was told that that we're going to get news from the White Flint development, owned by the Learners, that they have repositioned themselves and reoriented themselves. I've been approached by a number of developers who say they have life sciences companies already. I haven't even turned the shovel, already talking about locating in White Flint and wanting to be in White Flint next to the metro. There are some other things academically. I had a meeting with the entire university system last week about bringing programs. They thought I was talking about a university. That made them really nervous. And I said, no, I don't want, you don't got to build a university here. I need programs here that'll support life sciences, and I need programs that will support computing, machine learning, and artificial intelligence. I don't give me any university. Just let's plan on putting programs on top of that metro. I'm talking to Howard University, which has expressed an interest in Montgomery County, as well as some other universities. We are all centering on trying to do this here. It is the largest undeveloped tract in the county that's located on a metro station that is right down the street from Shady Grove Life Sciences, right up the street from NIH, hop on the Beltway and you're at FDA. It is the perfect location. And it was perfect for Amazon with some wrinkles, but it's even better for us. So I'm excited about this. I know I'm an unlikely person to be doing this. People are like, this is what you want to do. It's like, yeah, I cannot fund any of the things we need in this county if we can't get the businesses growing again. So without new jobs and new revenues, there are new social programs. There's no ability to expand the school budget. It is that simple. And so I'm not going to give away the store, because if I give away the store, I don't get any money either. So we're going to work in a way. I think the simplification of moving to development districts is going to make this a lot easier for people to swallow. I won't be looking for large bags of money. Our permitting department is a totally different department than it used to be. They don't cut any corners, but if you've got a problem, instead of saying, I had to fail you, come back again, they'll actually sit down and tell you why they failed you. So when you go back to your architect, you can say, this is the problem, this is what you need to fix. It is a whole different culture. It's a different culture in procurement. We've broken up the old boys network, the limitations on who gets to bid on contracts. We're opening this up. More people are being able to bid now, are included in the ability to bid on county projects. So we're making kind of fundamental changes and things that the business community rightfully blame the county for. And we're going to change those things. Plus, we're going to bring in a work program to bring jobs here. So I'll stop there. But that's sort of where we are.
Thank you, County Executive, for that horizon. I know we have lots of questions. We've got a big group of over 50 people. Jackie is going to help me manage some of the questions. We're going to ask people to keep your computers muted. If you're not asking a question, we prefer one question per person. And we'd have a real preference for people who are members of neighborhood associations and civic associations. But we'll try to answer as many questions as we can. Just a commercial. We'd like you to support your neighborhood civic associations, and we'd like you, if you're not a member of the Civic Fed, to join. And you can join by going to our website, which is montgomerycivic.org. There's lots of good information there. This is an organization which started in 1925. We're looking at our 100th anniversary. So Jackie, can you kick off some questions for the county executive?
Bet. One question was, can you talk about the implementation of the Racial Equity and Social Justice Act passed more than a year ago? Specifically, is the new Racial Equity Office reviewing the impact proposed legislation has on various demographic groups?
So this is divided between us and the council. But yes, our folks are looking at racial impact on things. But it's new. I mean, we just had one person was appointed in the late winter, and the 2 staff members were only just now approved and hired. So that is what they are doing. And as we staff up, they'll be able to review more stuff in not park and planning, but the council, when they introduce a bill, is supposed to run it through a racial equity lens also.
Hey, Mark, this is Jean Kavanaugh. How you doing?
Thank you.
Hi. I asked that question. Sorry to interrupt, Jackie, but so will the Racial Equity Office issue a report or some commentary on each piece of legislation and ZTA and plan that the council approves?
So I
don't think it has to be in writing because
I think the council may have approved that their people are going to look at the plans. I'm not sure. I'm not sure where that is. On legislation, the council members have to put it through a lens over there on things I propose and operations, things I put in my budget have to go through our racial equity office. We're trying to train people in the departments so they can do that evaluation on things that come through their department, which is what I'm hearing now when I'm in conversations. And everybody's trying to figure out, what it all means, because there's no such thing as a racial equity lens that I can hand you and you're going to put it on over your glasses and then be able to look at things. You have to be trained and you have to have evaluative tools and you have to know what to evaluate. So these are all things that our people are getting trained in, and then that'll be reflected in the work they do.
And you say the council looks at legislation through a racial equity lens?
They're supposed to.
They don't. When you see they look at the budget impact, they have that little statement after each piece of, there's nothing about racial equity.
It's in effect now. So stuff that starts coming up in this session should have it. And zoning stuff, I don't know how they don't have it.
We've got a question from Peggy Dennis, who's muted.
Sorry, Mark, I want to give you, can you hear me?
Yeah.
Mark, I want to give you a big hug because your Department of Transportation finally did something really useful on MacArthur Boulevard, where we have had a decades-long problem with people parking illegally between Old Anglers Inn and Brickyard Road. Yeah. DOT finally put in mini Jersey barriers with bollards all along the canal side, and nobody can park illegally there. They're not doing it on the other side, so the illegal parking is still going on, but it is better. And I did have a COVID question. Does the county have a system where people who want to be vaccinated can sign up, give their age or birth date, their address, zip code, and be on a register so that we can be contacted when our time comes up for vaccination?
So that is what is going to get put together. We're only at we're only going into the 75-year-old, and that might be 3 weeks away.
Yeah, I don't quite make that.
And I don't make that either. So when that happens, then there will be something in place by then. I don't think we're going to use the state platform. The other thing is that supposedly at some point your physicians are going to be able to register you, and we're still trying to figure out whether the doses are going to be given in the physician's office or if they're going to be done in a big center.
That's a problem because many of us have our physicians down in DC and not here in the county.
I'm not sure if it's many of you, but I'm sure there are. I'm sure there are people who do.
But thank you.
Yes, but they will have a way to register.
Jackie, do you have a question?
Yeah. Has the county?
Other people, if you want to use the raise your hand function, it'll be easy for us to identify you. You want to if you want to ask a question. I see you, Joe. I see you, Jerry. I see you, Alan. Please, Jackie, I'm sorry.
That's okay. We do have a lot of questions that are in the group chat, so that have been there for a while. So has the county considered enforcing a mask requirement when people leave their homes?
Nobody wants to arrest people. or fine them. I will say that I rarely see anybody without a mask on, except on a trail, and usually if they're running. But by and large, when I've gone to, to a store, or if I've been, walking on a commercial street, everybody I've seen has been wearing masks. We have pretty good acceptance right now.
Has there been any estimate, or are you looking at any projections of how the square footage of private businesses in the county will be reducing, their footprints, which the county may do as well, as more people work from home?
So this is one of the reasons why I don't think they should do the master plan update now. It's all predicated on yesterday's business climate. And everybody in the world is talking about not bringing their employees. I mean, not only, now they've discovered that teleworking works. And that means they get out of a lot of rent. And so why would you rent a place if you didn't need all the square footage you were renting? It's just a bad business decision. So I think you're going to find shrinkage. And what I'm interested in is, and I've already talked to a couple of developers, is if you really, don't need a building or you're going to deoccupy it, why don't we talk about converting it to residential? I mean, it'd be a lot easier than knocking something down. There's no reason to leave the buildings empty, but these represent opportunities to take a built structure and turn them into residential buildings. So we're going to continue to monitor that. And every time I hear of or see a commercial building going up for sale, we're going to see if we can explore the possibilities of a conversion to residential.
Let me ask a question that I know that some people on this call are interested in. Council member Jawando and the planning board have been investigating missing middle housing. And it's been a topic of discussion on many listservs. Do you have an opinion on where the council member and the planning board are going with missing middle housing?
Yeah. So you should Google the origin of missing middle. It was in a real estate broker's comments on their, I guess, his blog, and he didn't actually mean anything by it. I mean, it's hard to define what missing middle is. Is it a price point? Is it the size of a unit? It's not defined. And the plan doesn't actually plan for missing middle housing other than talking about single family neighborhoods, which I find just totally weird, because most of the development of the county is going to happen in the areas that are ripe for redevelopment, with have zoning that allows for reconstruction of buildings. So in Bethesda, the planning board is zoned for luxury housing. So if missing middle is so important, here's a place where you could have dictated missing middle, and you didn't. In fact, you've taken apartment complexes that were more expensive than MPDUs, hence in the missing middle bracket, and targeted them for redevelopment into more expensive housing, and then point your finger at the single family neighborhoods and say, that's where the missing middle is going to go. Well, I don't think you're going to get very much of anything, because somebody would have to want to cut their house up into 3 or 4 pieces. That's not necessarily a good thing. And it's not cheap. And if a house costs, I don't know, on the edge of Bethesda, $1 million maybe, then the price of that lot is at least $1 million. But if I own the lot and I know you're going to try to put 2 or 3 housing units on it, it's not $1 million anymore. I'm going to be asking for more money because it's worth more money to you. So they're not going to get any affordable housing. That's just total nonsense. And if they actually believed it, they should say that missing middle housing will have price controls on it. It'll be like MPDUs, and it has to be affordable. And of course, they're not going to do that. So this will be opportunities for more luxury housing. I could see where, EYA might buy up a block of houses and build, 3-story apartments with elevators, which they're really good at doing, 3-story townhouses. There's no guarantee you're going to get what you need. And since you haven't defined what you need, either in terms of price or size, it's hard to say. And when the zoning in Bethesda is producing 80% 1-bedroom apartments, who is this middle? I asked before, I suggested that, on the edges of a place like Bethesda. You go to townhouses and garden apartments. When they were doing the Rock Spring development, instead of more tall stuff over there, they should have put in, it would have been a great place for garden apartments, which would have been affordable. It would have been a nice setting with decent amounts of green around them, but everything is big. So I'm baffled by what they're doing, and I actually don't believe it's going to work.
Thank you, Jackie.
I was going to call on some of the people who'd raised their hands
That's fine.
online.
Please do.
So Alan Myers, would you like to ask your question? You need to unmute yourself
I
first.
did. It's not a question, it's a statement. Or it is a question to you. Has the Department of Transportation given you any inkling of the problems with the residential permit parking system? I'm in Maplewood, and I've got on the line here, we should have Parkwood and Edgemore. All of us have experienced problems with this contractor who came on board in 2018. It's like whack-a-mole. And as great as help as Scott Ryman has been, he can't solve the problems. It's people can't log on, they lose their passwords, they can't register their cars, they can't renew their permits, they get tickets for illegally permitted cars. One resident even got told that the street on which she lived doesn't exist in her neighborhood. So
it's special.
Huh?
You know, I'll tell you who to contact in my office. I wonder, is Debbie on this call? I don't see Debbie on this call. Bummer. Okay. The person to talk to would be Dale Tibbetts.
Dale Tibbetts?
Yeah, he usually and has always kind of, handled these kind of issues. So if I've hated the residential parking system since I was on the council. I don't know why I just can't give people, stickers or things you put in your window and give your guests to put in the window and call it a day.
It worked well, I say better with the old contractor. It seems like with this new contractor, you're just wasting a heck of a lot of money and raising the frustration level of the residents who have to live with it.
Okay.
Okay.
Yep.
Thanks.
Okay, a question from the chat. What is the status of the RFP for constructing MS4 permit projects? And will there be opportunity for citizen input?
On which part of that process?
That's over to Ken if you want to elaborate. Ken Bauer.
Yeah, hi, Marc. Yeah, my understanding is there's a draft RFP out that's going to be awarded to some construction company to construct all of our MS4 projects. And so last I heard it was on hold. That's all I know.
So there's no one construction company that's going to do all the projects. There's supposed to be a group of companies that do the projects.
What is an MS4 project?
It's a stormwater permit. And they tried to focus on high impact, high impact streams, and throughout the county, not just in the more rural parts of the county. But I don't know where they are with the permit right now. You could, Ken, Dale, right?
Yeah.
Or Debbie.
Yeah.
So you could ask Debbie for an update on that and see where they are.
All right, will do.
Okay. I know they'd met with people about what kind of things they were looking for and what types of projects they wanted to put in there.
Okay. Thanks.
Next question. What are your opinions of changes proposed to single-family neighborhoods proposed by Thrive Montgomery 2050 and the ZTA 2007?
Like I said, I think a lot of it's fantasy. I mean, because you can't change the lot lines because for example, you own your house and your lot. You can change the overlay any way you want to change it, but it doesn't change the fact that each one of those is owned by an individual. And so it's really questionable. If that's your strategy for affordable housing, It's utterly going to fail because people are not voluntarily going to do those conversions, not at the scale that you need to solve this problem. The way you solve the problem is, I don't know, you're the planning board, you require 3-bedroom apartments as part of the mix of every apartment building. You require 20% affordable housing, 10% MPDUs, 5% below MPDU, maybe 5% up to 100% of AMI. You require the kind of housing that you want. If people want to see how the planning was done originally, when they did the master general plan in 1964, they deliberately talked about, workforce housing in the urban areas, and that they were going to build apartments that government workers could live in. The flaw in the 60s was that the world was segregated, and Maryland still had, Montgomery County had covenants that limited where people could live. But if you took away the covenants, as soon as the covenants were removed, we got an influx of folks coming to live in Montgomery County of all races who could do it. And income became the biggest barrier to housing, but people who could get into a single family house got there. And a lot of the leaders of the civil rights movement in Montgomery County cut their teeth on fair housing and being able to allow to buy single family houses in neighborhoods. So I don't view these as, the demon structures. They're things that everybody, wanted. And the crime in this county was the segregation that was put into the law and permitted by the covenants, and then the refusal to enforce the Fair Housing Act. But this isn't going to solve, it's not going to solve a problem because it's voluntary. The planning board controls the rules for tens of thousands of new units. They can either all be tens of thousands of expensive 1-bedroom apartments, or they can require a mix of units that allows you to integrate the community. And putting it into this thing is, to me, it's a diversion.
Next, I'm going to call on Ira Unger for his question.
Hi, Mark.
Hey, how you doing?
Good, 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 thanks. So the first thing I want to do is thank you so much for everybody for the strictness that you've done during the COVID, that you've helped us immensely by keeping the county tight. So on the COVID, I wanted to ask you something. We're not going to get vaccinations, most of us, for quite a few months, and I'm wondering if it's still the policy of the county to try to establish contact tracing, rapid testing and contact tracing and quarantining.
Yeah. Still testing, tested more than 10,000 people again last week. I think maybe more than 12,000. So we're testing like crazy. We've tested.
Okay, so let me get to the matter, because testing only works if you can get results within 36 hours. Otherwise, it's too long. And the last time I spoke to Travis Gales, he said that, well, he said 2 days, but the fact is that at any of the county sites or any other site, there's at least a 3-day turnaround. And I know that my son just got tested in Atlanta a few days ago with a 36-hour turnaround. So I'm wondering if we can push the county to have more rapid turnaround so we could actually have successful tracing and quarantining.
No, it's not the county. I don't do any of the testing. I don't do it. All our people do is administer company tests. They then go back to companies to process. I don't have any testing equipment. I don't have any PCR machines.
Right, but some companies are doing it faster than others, obviously.
Yes.
So can we get to those faster companies?
Even inside of Montgomery, well, they don't have capacity. I mean, they got overwhelmed. They got overwhelmed at Thanksgiving. They got overwhelmed at Christmas. They've been overwhelmed all through the Christmas holidays. We've ramped up our testing from, a couple of thousand a week to 12,000 a week, and that's only us. We're a small part of all the testing that's being done in Montgomery County, because people are getting tested in doctors' offices, CVS, and a bunch of other places. So the only thing, we have told them how we feel. The state knows how we feel. Everybody's feeling the same pinch. I don't think it's any worse in Montgomery County than any place else. It depends who the tester is. My own family, They got tested and they got results within 2 days, which was reasonable. But at the same time, I know people have waited a week and never gotten an answer. So we're doing what we can to keep the pressure on. They need to frankly buy more equipment and then hire the staff to process the equipment.
So who are you depending on? Who's the they? The state?
No, this is all done by private companies. The state, we contract, the state contracts. People go to CVS. CVS doesn't do this themselves either. They contract.
So if I know that Atlanta, Georgia does it in 36 hours, what's the next step for Montgomery County to see maybe what is Atlanta doing that we're not doing, that they're getting it back?
But I know Atlanta can't. There's nothing we're doing that is the impediment. The impediment is when it gets to the laboratories, whether or not they've got capacity. I can't alter that scenario, and I can't take somebody's test and send it to a laboratory that's not equipped to run that test. So like if I get a test from Bendectin and I want it processed, it has to go to a lab that can process a Bendectin test.
Well, maybe then the government has to lean on these companies to get more staff so they can turn it around faster. They're putting more staff in other areas and less staff here.
Well, I don't know if CVS is doing that, but in fact, all these companies are testing companies. The big names in testing, that's all they do.
Right.
But nobody was set up for testing the entire population of the state. I mean, they weren't. I mean, I would love to blame them, but the fact is they weren't set up to do it. And so we're encouraging them to do what they need to do, but it's not happening soon enough.
Let's take another question.
Kim Prasad.
Hi, Mark. How are you?
Good. How you doing?
Doing good. I'm calling, well, not calling. I just want to say thank you, a really big thank you. The fence that you put up in Wheaton is absolutely beautiful. And for everybody who doesn't know, the state originally wanted a 6-foot black metal fence up on Georgia Avenue as a median pedestrian barrier. And Mark was the only one who heard us and believed that Wheaton was worth more than a 6-foot metal fence. And I just wanted to say thank you. It was really appreciated and people love it.
I thank you very much. You were right. I mean, when you showed me pictures, and the truth is, they wouldn't have done that every place in the county, and you know it and I know it. Never would have gotten away with it. So I was really glad that they changed their mind. And we found a way to get that done.
Yes.
And thank you for being persistent, as you always are.
You're more than welcome, and thank you so much.
Okay, Joe Awkward, your question, please.
You're muted, Joe. There you go.
Okay. County Executive, so in our, we're in the Maplewood section, we do have a property, that Beckwith property. There was a fire there, September of 2018. So don't know if you are familiar with it, but it's the situation where there was some tunneling going on, and there's been a kind of protracted issue with that.
Oh yeah.
Okay. So I guess our question is, because it does fall right under our civic association. Obviously, the residents are extremely concerned. It's certainly been a blight on the community. What we've been wanted to see if first you had any information on it. The latest we've been advised that it's been with the county attorney, but it appears to be in kind of a loggerheads there. I wanted to see if there might be anything we could provide to our residents, because it's gone on for about almost 2.5 years now. And I'm just wondering if you had any updated, if there's someone in your office that we could also follow up with.
I could. So I'll tell you the same person, Dale Tibbetts.
Okay.
So it's Dale.Tibbetts, Tibbitts. I
Okay.
think maybe I'll even put that in the chat. There's a thought.
Right.
And write him, because I know we actually talked about it, not like immediately recently, but we've talked about this. And it was a matter, it was a legalistic matter of who has the right to go in and deal with it.
Now, does the county attorney, does he actually work for you?
Yeah.
I thought he did. Okay, or they did. Okay, because that's what we're told is in their office right now, and there might have to be some kind of agreement worked out between the, okay.
Yeah, they can't just move on the property.
Right.
Without going through hoops.
Right. Okay. So Dale Tibbetts, I will follow up with him. Thank you.
Okay, next up is Bill Wydrow.
Hi there.
Hi.
Another COVID vaccine question. I heard you say it would be administered through doctor's offices, but will CVS and Walgreens also be used for administering?
This is what we're waiting to find out. We need them to. Right now, the requirement is it has to be a clinical setting because somebody might have anaphylactic shock or an allergic reaction, whatever. So that becomes the first barrier to widespread dissemination. But the Walgreens and the CVSs that have clinics, along with all the other minute clinics, could become places where the vaccine is given out, and doctors' offices could become places where it's given out. It's a question about whether it's going to be more complicated to get the to get the vaccine to the office, or is it easier for the doctor to send the patients to one of the clinics, which hopefully will be spread out around the county. So there should be, by the time we get there, there will be multiple places where you can get the vaccine.
Okay, thank you.
Okay, next I'm calling on Jerry Garson for your question.
Hi. Can the county residents go to Western Maryland or the Eastern Shore to get vaccines, which are way ahead of the capital region? Or can a resident of Montgomery County go to Virginia, which is giving out vaccines to the people over age 75 now, or Washington, D.C., which is giving out vaccines to residents over 65 now?
Yep. I don't know where you can go. I imagine you can go any place in the state, but everybody in the state under the same. Everybody's in the states under the same rules we're under, which is we have to go through the stages that the state set. We don't. Let me make this clear. The county does not get vaccine except through the state and is expected to follow the distribution of vaccine according to the state rules. So what's on our website represents the priorities that the state of Maryland has given for distribution of vaccine.
Well, if you look at the state website, you'll see that other parts of the state have given out way more vaccines and have way less people than us.
How many vaccines have they given out?
Well, in parts of the state, that 2.58% of the people have gotten vaccines. In other parts, 3.05.
Yeah.
But in the capital region, only 1.42% of the people have gotten vaccines.
That's right. You know, 1.42% of the people in Washington capital region is multiples of 2% of the people in Garrett County. I'll give you an example. There's one county that got 600 vaccines for their group one. My group one is 50,000 people. Their group one was 600 people. So yeah, some people got through that, but their populations are minuscule. I have 1.1 million people. I probably have as much as all the rest of the small counties put together. So it's not a matter of, comparing us to that or Virginia, which either got more vaccines or they've got a governor which has put them out faster, or the DC, which is a state. And so DC, all the vaccines go to DC. DC's treated as a state. And DC only has one jurisdiction to vaccinate, which is DC. And so they make their own rules and they can do whatever they want to do. That's great. I can't do that. This week I got 6,700 doses. So what am I supposed to do? Vaccinate 2,000 more people or 20,000 more people? And I can't buy them because all of the initial production from these companies is going directly to the federal government. Part of Project Warp Speed, the sales of the initial loads or that they're delivering all go to the federal government. I asked whether I could buy from a company directly, and they said, unfortunately, no. Otherwise, I would have.
Robert Janko? You're still
muted.
Robert, still muted.
I apologize.
okay.
There are racial equity issues with placement of cell towers on top of subsidized apartment complexes, such as Park Ritchie exceeding by 58 times FCC limits. Yes, there is an FCC limit for multiple antennas on top of a building, and there are models. Once it's above the limit, the companies need to do remediation. However, TAR committee doesn't check on if FCC limits are exceeded on these apartment residents, like in their apartment. They check on the roof, and then just below the roof is the apartment, and there's no checking done. So we request that the TAR committee look into this and be reorganized while you're at it.
I've asked for a meeting with the Tower Committee. I'm really upset by the stuff I've seen in the emails, and they have no right to bypass the law. They have no right to not require, the required testing, and to give approvals to things that are clearly in violation of the law. I agree with you 100%. So if it's actually true, I'm gonna bring them in. I'm gonna bring in somebody who's raised these issues. I'm gonna have them answer every single question. And if I don't get the answers I want, I will make changes I need to make.
Thank you.
Okay, there's
Becky?
a question in the chat about use of synthetic turf in the county, which is a violation of MS permits even as they are now. And they said a few lawsuits under the Clean Water Act, and they're going to be a huge expensive liability in the county. So
I have seen no evidence that they're illegal under an MS4 permit. Because if that were the case, they've been used in the county for decades. And no one's ever told me they were illegal under an MS4 permit.
Mark,
I may not be able to. Hi, Kathy. I may not be able to do it as part of an MS4 permit. It doesn't mean somebody can't put down artificial turf.
Well, so the point is, I mean, there actually were a couple of comments there, but as part of climate action, fiscal responsibility.
Yeah, but you said it's a violation. You said it's a violation of MS.
Okay, well, I will send you the presentation that that Friends of Sligo Creek and we just gave to the Chesapeake Water Environment Association.
Send me the law that says it's a violation of.
Yeah, I will send you the parts of. So there is no law that says synthetic turf specifically, but what's happening with synthetic turf makes it a violation. It's just that nobody has addressed it as a violation yet. So, I mean, if you understand, understanding the MS4 permit, nothing except for stormwater is supposed to go into the stormwater facilities. If you introduce new pollutants through a point source, that is not allowed, but nobody has addressed that. And so it's sitting out there waiting to be addressed with a lawsuit. But I mean, that's the point. It's just if you take a new pollutant and throw it out there, that doesn't make it okay just because the pollutant didn't exist before or the regulators weren't aware of it before, doesn't make it okay.
But
so I'll send you the presentation.
How could anything that runs off a lawn, anything that is blows away or crumbles, how don't those all become violations?
Mark, this is a point point source of pollution that's on purpose put in place. Your sediment is different. It's a natural material, grass, and there are controls on that. This is a point source of synthetic polymer and chemical pollution that's intentionally put in place. They're
Well,
like mini
I don't support artificial turf. I just, I have to have, if I'm going to ban something, I actually have to have legal basis for banning it, other than the fact I don't like
Well,
it.
there's a lot of reasons to ban. Well, okay, there's a couple of issues here. I mean, this is just one other issue that's coming up, and this is coming up from I'll just tell you, this is coming up from regulators. Okay, this is coming up from inspectors. This is, we actually were kind of pushed to address this aspect of it. But there's a lot of other reasons. The climate action plan, it's low hanging fruit. You're replacing acres and acres and acres of something good, of plastic, of grass, oxygenating, cooling grass with heating and chemical and microplastic pollution.
I don't disagree about that, except what do I do about it when it's over concrete? That it's not replacing
It's
it.
very rarely over concrete.
Well, that's
Marc.
the controversy right now, is over concrete and silver.
Yes, I know. And that, and well, you don't, that is actually an issue because you're introducing a point source of pollution where one did not exist before. So you don't want to do that. You don't want to introduce PFAS chemicals and microplastics. There is no rationale or reason to do that.
Well, I'm supposed to be getting a breakdown of what this product is and what's in
It's
it.
a plastic carpet, Marc. It's not whatever they.
I haven't seen it yet. I said I'd look at what they had. I'll look at what the product sheet says. I know how to read. I'm not happy about doing that, and there are other things they can do.
Hey, Kathy, I think you're preaching to the choir. We've got a couple more questions in the chat. Jackie?
Yeah, the East County has long been promised by a developer. The big things are happening in the White Oak area. What is really happening in White Oak?
Nothing.
Great program. Is anything gonna happen?
Look, I mean, he told us, I was on the council.
No, you can't possibly.
I was on the council when he came in to all those master plan meetings, waving an envelope and saying, you have to approve this master plan now. You can't wait, you can't delay me. I have all these companies that want to come here. I believe it is at least 8 years, if not 10 years, past that master plan. There is not company number one there. Not company number one. And the county gave away millions of dollars of land. Now the council's giving away millions of dollars of infrastructure they put us on the hook for. We'll see. But there's never been a project proposed over there. So, and the government doesn't control that. That's hundreds of acres that are under private control.
Okay.
Another question, Jackie? Was there
Okay, another question?
Was there another question, Kat?
Are there plans to address the large number of number 6 polystyrene plastic being used in county restaurants? I mean, they can't be recycled and they keep being thrown into the recycling.
Which product?
It's number 6 plastics. They have a number 6 on. They can't be recycled. The guy who was the head of your Department of Environmental Protection,
Adam Ortiz.
wants to get it banned. And do you know about that?
I don't know about it, but it's fine with me. I mean, I tried to write the law where I could ban, once we got the law through, it had a clause saying that I could then ban additional products when it was determined the market had a reasonable substitute. And there are reasonable substitutes for number 6. But the council took that out of the law, so we have to write a separate law for everything we want to ban. And I think this is on Adam's list to do.
Jackie, could I follow up? This is Frances Spiegel.
Mm-hmm.
I asked the question. I wonder, because in looking at the language of the ban, which bans expanded polystyrene like styrofoam, it says that what has to be used is something that is recyclable by the county. And since number 6 is not recyclable by the county, there seems to be an argument that potentially it could be already considered banned if the county were to interpret it that way.
Yeah, but polystyrene isn't expanded It's not the
Right.
expanded, right? So,
Correct, it's not, but the law says in the definition that it has to be a material used that the county can recycle, and the county cannot recycle right now,
Right.
polystyrene number 6.
but if it's, So you're saying this is what replaced the expanded styrofoam or polystyrene?
Yeah, so my husband and I have been doing a lot of eating out, trying to support our county restaurants, and we've discovered that, it's disheartening to see how much of the material in the packing cannot be recycled. And so I looked it up because I was curious, and then I read the legislation itself, and you could read the legislation in the definitions to say that although, it has to be replaced by something that is recyclable, and number 6 is not.
So Debbie, not Debbie, Francis, I put Debbie Spielberg's address in the chat.
Mm-hmm.
Explain this to her and write her an email on that.
Okay.
Thank you.
Thank you.
Okay,
Mark,
we have-
Mark, I've got a question. Actually, I have 2 questions. One's about pedestrian safety, and we still see lots of pedestrian fatalities across the county. I wonder what kind of initiatives you're doing on Vision Zero to reduce the pedestrian accidents. That's a softball.
It's very frustrating. There are a variety of causes for pedestrian accidents. Not all of them happen in crosswalks. Cars go too fast. So I'm fine with the legislation that's going to drop the urban speed a little bit lower than it is today. I actually was the one that got permission from the state to drop the speed limits in the CBDs to 25. I wrote them back during the campaign. I wasn't even county executive. And I told them I wanted the ability to pull speed limits down to 25 in the urban areas. And the state let us do that. I am looking for permission now to, if you've driven through DC, you see these bollards, little white bollards all over the place. You come to an intersection and they got these poles and they square the corner. So you actually have to slow down to make your turn. The rounded corners replaced square corners. So the cars could swing around the corners, which you couldn't do it with the square corner. So I've asked for permission to reinstall to install these kind of bollards so I can square off corners, force cars to get farther away from the curb, make them actually have to look where they're turning, which hopefully will make them more aware of pedestrians. We're going to continue to look at what else we can do to make intersections safer. I'm still a big believer in hawk signals and more crosswalks. I think that our rules on crosswalks are too limiting and we should be willing to put more crosswalks in. So we're going to continue to work on that. And this has been a national problem actually since the pandemic, with more accidents, which seems counterintuitive because theoretically you have both fewer people driving and fewer people walking. But I get the sense that people are driving faster and with less regard for the law, mostly because they think things are emptier. I think that's contributing to more of these accidents. I mean, our roads were designed for speed limits 10 to 20 miles higher than what we list them for. And any chance people get to speed up, they seem to be happy to do that.
On Georgia Avenue, the speed limit's been reduced to 25 and people are regularly going 45 and 50 around University Boulevard, coming down through Wheaton. So is that a question of more enforcement?
Yes. That will be a question of more enforcement.
So we need to have some more enforcement. And then this last question comes up in a number of my conversations with groups around the county, is the question about solar energy and the commercial solar in the ag reserve. And I was wondering what your 30,000 foot view is on solar and getting to your goal of zero net emissions by 2035.
Look, I think it's perfectly feasible to put the amount of solar they've talked about on non-prime agricultural lands. And what bothers me is the unwillingness to say, we're not going to violate, storm with the buffers that we're not going to take down trees. I mean, you have 94,000 acres, you have to take down trees to put in the solar, and you're not going to stay off of prime agriculture. You should be able to get this acreage in. We're talking with both Pepco and the other company, which will no longer be doing coal, about the possibility of getting a substantial acreage from them converted to solar power. So I'm all in on converting to solar power, but I think until this came along, we were always talking about the ag reserve as the environmental gem and the biggest environmental policy the county had. And I find it a little disingenuous for all of a sudden, and it's like, oh no, it's just horse farms and not the agriculture we liked, and so it doesn't really matter if we do this up there. I think it matters very much, and if anything, what we ought to be doing is trying to work with the farmers to get them to grow table crops, which would genuinely address, from a global warming perspective and a local food perspective, it would mean there'd be less trucking of food. We get more food here on the table in Montgomery County instead of hay and corn. Plus, they don't grow the edible corn; they grow the stuff for animals. That doesn't make me happy. So that I think there is room for both, and I think the ZTA was just written in a way to just kind of shove it at people without thinking about how do I win and get what we need, which is additional solar. But we're also going to double down on solar in the built environment, and I hope the sponsors of that legislation are as enthusiastic about solar when we're talking about we need to do this in the down county and in the built environment.
Jackie?
We have one last question. Matt Losak, please go ahead.
Evening, everyone. Good evening, Mark.
Hey.
We should, as we started with COVID, let's end with COVID. Has any thought been given when the time comes, which I'm sure it will, when the vaccines start to come in copious amounts, eventually when the administration changes and production increases, about how to rapidly provide a field operation service of vaccine delivery? As heading the Renters Alliance and working in apartment communities all over the county, many of the renters, as you know, are senior or working families or working poor who are not as mobile, may not have family doctors, may not be as hooked into government services, and having worked through an regional emergency room all through college, I know it doesn't take much to train people to deliver vaccines, especially if under the supervision of a nurse or a trained professional. Does your planning include some kind of field operation to provide vaccine operations in apartment communities, particularly seniors and lower income?
So, I mean, the stages don't lump some of these things together. So it's 75-year-olds first, period. And then 65 to 74, period. And then it's vulnerable people under the age of 65, period. And then eventually you get around to the general population. So the way they've got it parsed out, it's very, very distributed.
You've got a scarcity of vaccine, but when the vaccine begins to come in where we have it, and now the issue is delivery, is there any thought to getting ready for that?
Yes, I mean, we've been talking about this. I was very pointed about this. I said it's great that we can get 8,000 doses out and probably 12 or 16. I need a plan for 25 or 40. And I've got to be able to get those many doses out. They have a list of over 200 people who volunteered, who have, I guess, credentials that would lead one to believe that they could help provide vaccinations. I don't think the site provision is a big deal. People are doing it in tents. Los Angeles opened up one of its sports arenas and has people coming in 24 hours a day to get the vaccine. But that's only going to work when you get to the point that anybody can do it and they can just come, which you can't do right now. Even with the 75-year-olds, it's going to be a call in, get registered, get an appointment. So we've got to get to the point, once we get to that larger volume, where we're just letting large groups of people come in.
Well, I'm
And
just suggesting.
then you would target a location.
That's what I'm suggesting is that these apartment communities could probably be accessible by teams. And obviously we'd like to help in that. And I just hope it's included in your planning.
And then the other thing I need though, is they need the state to say, it doesn't have to be a clinical setting. Because the clinical setting kills that.
We'll put up a tent with a red cross on it.
But you know, I've raised the question if I can put an ambulance. You know, if the ambulances that are attached to the fire stations, which do not go out all day long necessarily, if some of those can be attached to the places where we do testing that aren't clinics, so that if you need an ambulance, you've got an ambulance. If you need an EpiPen, you've got an EpiPen. So this is all being discussed, and we have a great sense of urgency because we actually believe, I believe anyway, that as bad as our numbers are right now in terms of vaccines, we will be getting more vaccines.
Let's take 2 more questions. We've had Mark for a long time. Joan, do you want to ask a question? You have to unmute, Joan. You're muted.
Okay, I'm unmuted. There are over 9,000 people at Leisure World. Many of these people are 75 or older. MedStar at Leisure World has been looking into administering vaccines to see if they could do it. Has there been any thought of administering vaccines at Leisure World for Leisure World residents?
So our people are talking to MedStar and the other hospitals, and we're trying to make them part of our planning for mass distribution. And so if MedStar wants to be the distributor, we're going to be more than happy to have MedStar as a partner to do the distribution there. You need one entity to adopt a Leisure World or some of these other large apartment complexes so we can do these things quickly. But that, I think if you're already talking to MedStar, that's a good thing. And I can follow up with them.
Mark, this will be the last question. Hank Ursulov has asked, what's the status of closing down the incinerator at Dickerson?
So Hank, as you know, that one of the parting gifts I got when I came in was a 5-year extension of the contract on Dickerson. And we are working, regularly now on a plan to dispose of the waste that goes to Dickerson in ways other than having to burn it. So this is why we're talking about a digester and or an alternative way of producing compost. Either composting or digesting are a possibility of those two. We are going to mandate food recycling, both for residential and for commercial businesses. This is just going to be the way things have to be done. But I've got to have a place to put it. We're hoping that when there's a private digester coming online in Jessup in the fall, that likely will have capacity for a while, and that may be an intermediate step until we identify a site for our own facility, but we're looking for our own facility. After I get food out of the waste stream, I've got to figure out a way to force apartments and commercial buildings to recycle. Because a lot of them right now, if you've ever been in the commercial building, they've got a trash can. You have the lobby and there's paper in the trash can, plastic, food, and bottles. And that is impossible to recycle that mix, or it's impossible to do it at a reasonable cost. So we're going to work on a plan for bringing in the private sector, apartments and commercial buildings too. But we're working on it so we can get a transition and get out of having to do what we're doing right now.
Thank you very much, Mr. County Executive. You've been very generous with your time this evening. You've answered many, many questions. We're big fans, and please let us know how we can help you move your agenda forward across the county. Let's give them a big hand for.
Thank you all. Look, I always appreciate working with you all, and you are still the eyes of the community on really important issues. And I think the biggest challenge, frankly, is figuring out how you go from your group to becoming a voice that then gets heard by people in the community, because most people in these counties aren't in these civic organizations. And they probably have a lot of people who share the things you're concerned about. And so thinking about how to make your ability to communicate with those folks, even if they're not part of the Civic Fed, I think would be really important, because you're tackling some really difficult issues, and you're going to need allies.
Thank you so much. You'll be pleased to know that we've invited Dr. Gales to come and talk to us next month about what he's doing as the public health officer. And the topic of our next meeting is going to be on police reform and accountability. And Chief Jones is going to join us for a presentation. So we'll get a chance to talk to him about those kinds of things.
Okay.
All right. Thank you.
Okay. Thank you very much.
Thank
you. Good night, Mark. Thanks a lot.
Good night, everyone. Good night, Gail.
Good night, and thank you.
Thank you. Thank you.
So people are dropping off our meeting pretty quickly now. We're from 50 down to 38. We hope that you who love the Civic Fed are going to stay for our committee reports. We can go through them pretty quickly, and this is the chance where you can offer up any suggestions for our work. So our first committee reports from Legislation Committee. Peggy, have anything to say about that? You still there, Peggy? Okay, we don't see Peggy, so we'll move on to public safety. And just to recap that, Marcus Jones, and I've invited Will Jawando to come and talk about the things that he's doing at the county council level on police accountability and reform. Transportation, Jerry.
Okay, I'm unmuted now. There's a public meeting tomorrow, which I'm testifying as an individual on the proposal for the state of Virginia has for bus transit between Maryland and Virginia. The meeting starts at 7 p.m. through 8:30 tomorrow night. If anyone wants to look at it, they can go online and look at the meeting. One of the problems that they did is that 20 years ago, they tried with 211 bus trips. They lowered it down to 170, down to 64, down to 0. In light of COVID-19, I can't imagine why most people would want to ride on a bus between Maryland and Virginia and be on a bus for even 20 or 30 minutes. WMATA is saying they're temporarily not making the drastic cuts that they were proposing for July 1st, but now they're talking about doing all these drastic cuts as of January 1st, 2022, which is, about 11 and a half months from now. The state is continuing to work on the proposal for widening the American Legion Bridge and widening the beltway between the American Legion Bridge and the western spur of 270, then up 270 to the I-370 interchange. That thing, they have 3 proposals that they're working on right now. And the purple line is basically on a very slow speed operating. We can see where Alan's picture behind him is actually where part of the route of the purple line will be. But as you can see, there's no construction happening right now. I know this is an old picture, but the purple line is going to be drastically delayed from what we can see. Thank you.
Thank you, Jerry. Public finance. I don't think we have a report on public finance. Land use and planning. Harriet, are you on? Do you want to say anything about that? I guess she doesn't want to say anything about that. The missing middle housing proposal, though, really is generating lots of interest among community groups.
Sorry, can you hear me now?
Yes, we can.
Okay. Yeah, first let me add something about legislation. I know Peggy must have dropped off, but all 4 of the bills that we testified about, local bills, have passed the House delegation unanimously, and they will move on to the Senate. So I just wanted to thank Peggy and Jerry for testifying about those. On planning and land use, I was wondering if Councilmember Jawando is attending our next meeting, if maybe he could touch on his ZTA about missing middle
Great idea.
and how that fits in with the Thrive 2050 general plan.
Great idea.
And that's all. I don't really have any other updates on, unless anybody has questions. Thanks.
Seeing none, Harriet. Environment. Anybody want to comment on environment? What I'd like to say about that is we will comment on the climate action plan. The comments are due by the middle of February, and we will submit some remarks on behalf of the Civic Fed. Right, Bailey?
Yes. A lot of comments came out of the Safe Healthy Playing Fields group. They were included in an article in the newsletter. The health and equity lens was supposed to overlay much of the communications effort that was all going to be integrated in the climate action plan. And it seems that the health and equity lens sort of was left by the side of the road. So I think that as people provide comments, we can help move things in a more comprehensive direction.
Thanks, Bailey.
Sure.
Anybody who has any, hey Bernice, anybody who has wants to make comments on the draft, the climate action plan draft, please do it as an individual, as an organization, or send them to us so we can include them in a comprehensive Civic Fed report to the county executive and the people who are working on that. Last committee report, I think, is education. Anybody have anything on education? Louis, you could talk about public utilities. Anything on public utilities?
No, nothing really to report on public utilities.
Okay, is there anybody else have anything for committee reports? Seeing none. Just want to make just remark that we welcome your contributions for the newsletter. Jackie Boco's done an outstanding job as our newsletter editor, as you can tell. And if anybody wants to submit articles for that, we will publish them from our members. I also want to thank Jackie, if she's still there, yes, she is, for doing a fine job moderating this Zoom call with letting people in and keeping up with the questions in the chat. So thank you, Jackie.
My pleasure.
Great stuff. We do have a couple of things. We have our annual awards meeting in June. And so we've got a couple of committees that we'd like to staff with volunteers. There's an awards committee. There is a nominations committee for the awards that we give up. Please look at the newsletter at the link that we discussed earlier, montgomerycivic.org. And if you'd like to help us, we do need lots more help. There's a lot going on, and we're relying on a precious few group of committed volunteers. So please get your neighborhood associations and your homeowner associations to support the Civic Fed, and please step up and help us do our work. I don't have any old business, any new business. Joe, what do you got? You're on mute, Joe. And you're still muted, Joe.
Yeah, sorry, I tried to unmute him. Let me try again. I'm not able to do it. Try from your end, Joe.
Goodbye, Joe. Oh, there you are. You're still, we see you, Joe, but we can't hear you.
Oh, I can't get him unmuted from this end.
Right.
On the bottom left-hand side of your computer, Joe, you should see a little microphone. It says mute.
And unmute, right?
Well, you click on it.
Mute, right.
We need you, Yudi. We need you.
I'm learning with all of you, so.
If he can't unmute, can he put the question in the chat?
You want to put in the chat, Joe? You'd have to type it in the chat, and then we can see what you're talking about.
Looks like he's going for the chat.
All right, so that's good. So we're at the No old business to discuss. New business. Those of you who have not paid your dues for the Civic Fed, please pay your dues. We're getting more members. We're getting more money, but I think some people who have been members have not renewed for this year. Hey, Joe.
Yay, Joe.
Oh.
You're muted.
Oh, thank you. Thank you. I had clicked that. Joe Walker, just a quick, actually it's for Jerry. When you reported earlier, Jerry, in the financial about the buses coming from Virginia to Maryland, I know years ago there were buses from like Tyson's to Bethesda and some other locations. Is that what they're talking about? And what are the details in that meeting for tomorrow night?
Yeah, that's basically what they're proposing, what we tried 20 years ago. They never had more than 5 people on a single bus. I have been in contact with them. I have 2 actually printed WMATA timetables that I sent to them, plus with data actually on the number of people who are getting on and off at different locations. So I provided them with a lot of information, but if they're illiterate or semi-literate, they might not be able to read this. To me, it's just an extreme waste of money, especially in light of COVID, where no one wants to use mass transit. I mean, rail is just basically down 90%. We're getting less than 10% of the people using rail. I haven't seen the new WMATA numbers since they started charging fares just on January 3rd. But I assume while we have free ride-on bus service in Montgomery County now, and we had free bus service in Maryland and in Virginia and in DC. So the bus ridership wasn't down as much because I suspect that many people took very short rides rather than walking. But once you start charging $2 or so for it, people start walking again. And I just see a lot of this mass transit right now just not being viable. I know our county executive keeps talking, well, he wants to see more people telecommuting. Well, if you're telecommuting, you're going to ride, why would you want to ride a bus one day a week? And basically, if you've been into Washington, D.C. recently, their parking lot rates have gone down significantly. Where actually, it's right now, you can often, by the time you pay for a round trip to Montgomery County and for parking is literally more than, cost you more than driving into D.C. And since the traffic in D.C. is fairly light, not that many people are driving into D.C., so the parking lot rates keep dropping. You can get parking in the K Street area for $11, $12 before 9 o'clock in the morning for a whole day's parking. It's going to cost you at least $15 to use the Metro. So they're actually in a, basically, to me, I see they're in a death spiral.
Yeah. What do you have the contact info for the meeting though tomorrow night? Is it a WMATA meeting or the 7 to 8?
Tomorrow's meeting is actually by the Virginia Department of Rail and Public Transportation.
Okay.
And if you go to their website, it's DRPT, you can actually log on and join the webinar if you'd like to.
Okay.
I'm going to be testifying as an individual because I was involved in trying to help them when they proposed this original proposal. I was in favor of the original proposal, but Harry Sanders had said, well, if we try bus transit between Maryland and Virginia, it's going to fail and we'll never get the money to study heavy rail. So I start questioning some of these people. What is their real motive even? And of course it failed. And one of the things they had asked, well, what's going to happen if we get stuck in traffic? Can we use the shoulders? And I said, I would speak to State Highway Administration, have them speak to State Highway Administration. We got signs put up 20 years ago. And would you believe it? One of those signs is still on the beltway between the 2 spurs of 270 heading eastbound. The sign is still up from 20 years ago. So if they want to put this service in, the sign is already up.
Okay. See, we say one side. Thanks for the time. I know it's late. Thanks.
Thank you, Jerry. Thank you, Jerry.
Thank you, Jerry.
You're standing between us and a motion to adjourn. Do I hear a motion?
So moved.
So moved.
Second?
Second.
Okay, everybody. Hope to see you at our February meeting with Travis Scales and Chief Jones. So
thank you.
Be careful out there. Thank you, Yudi.
Bye.
Thank you, Alan.